My name is Sarah Hurst, and this is my head to toe for fall of 2024. Today's date is August the 27th. I'm going to scan the room. So this is my patient. And then the floor. And then all of my utensils. And then the ceiling. Okay. Okay, so first I'm going to start off by assessing the skin of the patient. I'm going to be looking at the head, the neck, the face, the anterior and posterior chest wall. I'm going to be looking at the color, the temperature, if there's any bruising, scarring, edema, if any of that is noted. So the skin is dry and intact, it is warm to touch, and there's no deformities noted. Next, I'm going to assess the head. It is normal cephalic in size. It's midline and symmetric. Next, I'm going to assess the scalp and the hair. So the hair growth is equal in distribution. The color is brown. The texture is soft. There's no masses, depressions. There's no infestations, and there's no tenderness noted. Next, I'm going to assess the temporal arteries for tenderness. Is that tender?
No.
Next, I'm going to assess the lymph nodes of the head of the neck. I'm going to start with the preauricular, postauricular, occipital, submandibular, submental, anterior and posterior clavicular, and supraclavicular for tenderness. Was any of that tender?
No.
Okay. Next, I'm going to assess cranial nerve 5, the trigeminal nerve, for motor and sensory. For the motor, I'm going to have the patient open and close their mouth. Okay. Next, for sensory, I'm going to have the patient close their eyes and tell me where I'm touching.
Forehead, cheek, nose, chin.
Okay. Next, I'm going to assess cranial nerve 7, the facial nerve. I'm going to have the patient smile and frown, raise their eyebrows, pucker out their cheeks, and pucker out their lips. Next, I'm going to assess for TMJ. I'm going to have the patient open and close their jaw, and then open and move it side to side. So there's no sublation, crepidus, or tenderness noted. Next, I'm going to assess the ears. I'm looking for symmetry, if there's any deformities noted, and they are symmetric on both sides, and there's no nodules or anything. Next, I'm going to palpate the pinna and the tragus for any nodules or tenderness. Is that tender?
No.
Okay. Next, I'm going to assess the tympanic membrane and the auditory canal. And the tympanic membrane is pearly gray and translucent, and the auditory canal is clear, and that is bilaterally. Next, I'm going to assess cranial nerve 8, the vasicular nerve. I'm going to do the whisper test. I'm going to have the patient close their ear away from me and whisper with me. 1, 2, 3.
1, 2, 3.
Okay, and now the other side. 1, 2, 3.
1, 2, 3.
Okay, now I'm going to do the Weber test for lateralization. Tell me if you hear this greater or less on one side.
No, it's the same.
Okay, next I'm going to test the Ryan test. Tell me if you hear the vibration.
Yes. 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 Yes.
Okay, so air conduction is greater than bone conduction. And that is bilaterally. Next, I'm going to assess the lashes and the eyebrows. I'm going to be looking for palpable fissures, and none are noted. Next, I'm going to look at the sclera and the conjunctiva. So the sclera is white and the conjunctiva is pink, and there's no discharge noted. Next, I'm going to assess cranial nerve 2, the optic nerve. I'm going to have the patient, I'm saying 6 feet back, but close or cover one eye and read the lowest that you can.
LTFPH.
Okay, now the other one.
LTFPH.
Okay, now both eyes.
LTFPH.
Okay, so patient has 20/20 vision. Next, I'm going to have the patient look at the wall behind me. Okay. Now I'm going to check for peripheral vision. This is part of cranial nerve 2. I have the patient cover their eye away from me and tell me what finger, or
One.
what finger shall I hold up,
1,
and cover the other eye.
1,
So now I'm going to assess for accommodants, accommodation and convergence. I'm going to have the patient look at the wall behind me and then my finger and follow it. Okay. Now I'm going to assess for cranial nerve 3, 4, and 6. So 3, the oculomotor, 4, the trochlear, and 6, the dehiscence. I'm going to have the patient follow my finger in the 6 cardinal signs. Okay. Next, I'm going to assess for the red reflex. So I'm going to have you look at the wall behind me, and usually I would dim the lights, but for the purpose of the video, I won't. Okay, so optic disc, red reflex, and macular are present. Next, I am going to assess the nose. I'm looking for symmetry. It is symmetric and it is midline. I'm going to assess cranial nerve 1, the olfactory. Any sounds?
yes.
Okay. So cranial nerve 1 is intact. Next, I'm going to have the patient close one side of their nostril and breathe in and out. Then the other one. I'm checking for nasal patency. Next, I'm going to assess the mouth. I'm going to look at the lips, the teeth, the gums, the buccal mucosa, the salivary glands or ducts, the tongue, the under the tongue, the palate, the anterior pharynx, and the tonsils. I'm going to have the patient open their mouth. Okay, so the buccal mucosal is pink and moist, and the tonsils are not gradable. Next, I'm going to assess cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. I'm going to have the patient open their mouth and say "ah." Okay, so cranial nerve 9 and 10 is intact, uvually rises with and falls with phonation. Next, I'm going to assess cranial nerve 12, the hypoglycemia. I'm going to have the patient stick out their tongue and move it side to side and up and down. Okay, so cranial nerve 12 is intact. Next, I am going to palpate the maxillary sinus for tenderness. See that tender?
No.
Okay. Next, I'm going to assess the neck. I'm going to be feeling for the trachea. It is midline symmetric. Now I'm going to feel for the thyroid gland. I'm going to have the patient swallow. Okay. Now I'm going to feel for the carotid pulses. And they are 2+ bilaterally. Next, I'm going to listen to the carotid arteries for any breweries with the bell of my stethoscope. And I'm going to have the patient hold their breath. And the other side. And no breweries were noted, which is a normal finding. Now I'm going to have the patient stand up and turn around. Now I'm going to be assessing the posterior chest wall for any signs and symptoms of respiratory distress. I'm going to be looking for tripod positioning, cyanosis, tachypnea, retractions, use of accessory muscles, and none of that is noted. I'm going to feel for symmetrical chest wall rise and fall, so breathe in and out. Okay. Now I'm going to feel for a tactile fremitus. I'm going to have the patient say 99.
99, 99, 99, 99, 99, 99.
Okay. Now I'm going to listen to the lung sounds. Now I'm going to listen for agophony. I'm going to have the patient say EE.
EE, 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 EE.
Okay, now the bronchophony, I'm going to have the patient say 99 again.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, now the whisper, I'm going to have the patient whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Now I'm going to have the, I'm going to percuss. Now I'm going to have the patient even turn back around and sit down. So I'm also going to look for signs and symptoms of respiratory distress on the anterior chest wall, and none of that is noted. I'm going to feel for chest wall rise and fall, and it is symmetrical. Now I'm going to feel for tactile firmness again, 99.
99, 99, 99, 99, 99, 99.
Okay, now I'm going to listen to the lung sounds. Okay, now I'm going to listen to the heart tones. I'm going to use the bell and the diaphragm of my stethoscope. I'm going to start off using the bell. So the aortic, which is in the second intercostal space on the right side, pulmonic, second intercostal space on the left side, Erb's point, the third intercostal space on the left side, tricuspid, the fourth intercostal space on the left side, and the mitral, the fifth intercostal space, macroventricular on the left side. Now the diaphragm, so aortic, pulmonic, Erb's, tricuspid, and mitral. Now I'm going to feel for the PMI, and now I'm going to listen for the apical pulse. I would do this for originally for 60 seconds, but I want for the video. So the rate is 70, the rhythm is regular, and S1, S2 heart sounds are noted. Now I'm going to have the patient lay down at first at a 35 to 45 degree angle. I'm going to check for JVD, and have the patient look that way and this way, and then noted, and now flattened. I'm going to be assessing and looking for any heaves or lifts, and they're noted. I'm going to feel for any thrills, so aortic, pulmonic, Erb's point, tricuspid, and mitral. None are noted. I'm going to listen to the heart sounds while the patient's laying down, using the bell and the diaphragm. So aortic, pulmonic, Erb's, tricuspid, mitral, aortic, pulmonic, Erb's, tricuspid, and mitral. Next, I'm going to listen to the arteries and see if I hear any breweries, and I'll be using the bell of my stethoscope. So aortic, renal, iliac, and femoral. Next, I'm going to listen to bowel sounds in all four quadrants. They are normal active. Next, I'm going to percussive. Okay, dullness is noted. Next, I'm going to see if I can palpate the liver and the spleen. I'll have the patient hold their breath. Okay, on the other side. Okay, so the liver and the spleen are not palpable, which is a normal finding. Next, I'm going to feel in the abdomen for any masses or tenderness. Is that tender?
No.
Okay. Now we're going to have the patient stand back up and then face the wall. I'm going to assess for CVA tenderness, so let me know if this hurts.
No. No.
Okay. So no CVA tenderness noted, which is normal. Have the patient sit back down. So now I'm going to be looking at the musculoskeletal. I'm going to look at the joints of the fingers, the hands, the wrists, and the elbows. I'm going to be looking for any swelling, deformities, crepitus, redness, tenderness, or any of that noted, and none are. I'm going to feel the fingertips for the Capillary feel, and that's less than 3 seconds bilaterally. Now the radial pulses, and they are 2 plus bilaterally. Now we're going to do the range of motion of the fingers, so follow along with me. So flexion, extension, hyperextension, abduction, adduction, thumb opposition. Now the wrists, flexion, extension, hyperextension, radial deviation, ulnar deviation, and rotation. Now for the elbows, flexion, extension, hyperextension, And now for the shoulders, flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and then circumduction. Okay, good job. Next, I'm going to assess the strengths in the hands. Have you squeeze the hands? So 5 out of 5 strengths in the hands. Now I'm going to do the biceps and the triceps. So pull up against me, and then push down, and then pull up, and then push down. So 5 out of 5 strengths in the biceps and triceps. Now I'm going to assess the shoulder girdle. I'll have the patient stretch out, and then pull up against me, and then push down. So 5 out of 5 strengths in the shoulder girdle. Next, I'm going to assess cranial nerve 11, the accessory muscle or nerve. I'm going to have the patient shrug their shoulders. Great, so cranial nerve 11 is intact. Next, I am going to look at the joints of the toes, the ankles, and the knees. I'm going to be looking again for crepitus, redness, nodules, swelling, tenderness, and none of that's noted, or deformities. I'm going to assess for cat refills of the toes, and they're less than 3 seconds. I'm going to assess dorsalis pedis pulses on both sides, and they are 2+ bilaterally, and then postibule, and they are 2+ bilaterally. Next, we're going to do the range of motion of the toes, so follow along with me. So this is flexion, extension, hyperextension, abduction, adduction, and then ankles. So dorsiflexion, plantar flexion, inversion, eversion, and then rotation. Okay, now I'm going to assess the strengths. I'm going to have you push up against me, and then push up against me, and then push down, and down. 5 out of 5 strengths in the ankles. Now I'm going to have you push out like you're trying to kick me, push out like you're trying to kick me, push in, and push in. That's 5 out of 5 strengths in the knees, and now push in, and then push out, and that's 5 out of 5 strengths in the hips. Next, I'm going to assess for light touch. I'm going to have the patient close their eyes and tell me where I'm touching them.
Knee, arm.
Okay. Now I'm going to do vibratory sensation. I'm going to do the wrist. Can you feel that?
Yes.
Can you feel that? Okay. And then the ankles.
Yes.
And
Yes.
okay. Now I'm going to assess the deep tendon reflexes. I'm going to do brachioradius, and then biceps, and then triceps, and then brachioradius, biceps, triceps, patellar, Achilles, and Babinski. Okay. Now I'm going to test for graphexia. I'm going to have the patient close their eyes and tell me what number I draw on their hand.
1,
This one.
2.
Okay. Now I'm going to test for sterophanesia. I'm going to have the patient close their eyes and tell me what I place in their hand.
Paperclip.
And that one.
Pencil.
Okay. Now I'm going to check for coordination. I'm going to have the patient touch their fingers together as fast as they can for cerebral finger-to-finger opposition. And then the hand flop. Okay. And now touch my finger and touch your nose. Okay. Now I am also going to be looking at the upper and the lower extremities. I'm going to be looking at the integument. Be making sure there's no swelling, deformities, bruising, and the skin is dry and intact. Okay, so I'm going to have the patient stand up. So now we're going to do the range of motion of the knees. So flexion behind you, and then extension, and then hyperextension. Now the other one. So flexion behind you, and then extension, and then hyperextension. Okay, so now the hips. So flexion, extension, and hyperextension, and then internal rotation. Can't really see that. So then internal rotation, external rotation, and then circumduction. Okay. So for the other one, flexion, extension, hyperextension, internal rotation, external rotation, and then circumduction. Okay. Now I'm going to have you face that way and then touch your toes. So that was flexion of the lumbar spine. I'm also going to be looking at the spine for any signs of scoliosis. The spine is midline, it's symmetric, and there's no deformities noted. It goes concave, convex, and concave again. I had the patient stand back up, and that was extension of the lumbar spine, and then lean back towards me. That's hyperextension of the lumbar spine, and then side to side, and that's lateral flexion of the lumbar spine. So now for the cervical spine, I'm gonna have the patient touch their chin to chest. So that's extension, and look straight ahead. So that was flexion, and this is extension, and look up is hyperextension, and then ear to shoulder. So lateral flexion on both sides, and then look back at me, and then for the lumbar spine, I'll have you look back at me too. So move like your whole side. There you go. Okay, so that was also a rotation of the lumbar spine. Okay, so now I'm gonna have the patient turn back around, and then close your eyes. I'm gonna do the Romberg test for balance. So balance is good. So now you can open your eyes back up, and then walk regular, and that way I'm assessing their gait. And then turn around and do heel to toe for tandem. Yes. And then turn back around, and then hop on one foot, and then the other one. Okay. And that concludes my head to toe.